K-Wave 6 Radio and our host Kirk Spencer welcome you to our show bringing positive messages to today's world. And now, here's Kirk.
Hello and welcome to K-Wave 6 Radio. Today my guest is of special interest, especially for women. This gentleman is, well, as I call him, a young man in my perspective, who I used to work with years ago back in Chicago, is specializing in women's, let's say, health issues. He is a holistic therapist, a holistic doctor, actually. He is going to tell us a lot more about his how he got into the work that he is into now, and how he actually evolved into working with basically women's problems. So without me stumbling over anything else further, let me introduce you to Dr. Nick LeRoy. Welcome to the show, Nick.
Thank you, Kirk. It's a pleasure to be here with you.
Well, it's my pleasure to finally get you on here. I know that you're busy and whatnot, and just from talking off air, you're talking about a lot of changes that you've gone through in your practice and in your own, because you do have your own clinic there, and it's like the health industry. It is a growth industry, and it's always changing. That's the growth that I'm talking about. It's just that things never always remain the same. It's kind of like life. The only consistent things in life is change. So why don't you start us off with what you were talking about before, about when you were in college and studying your particular subject of healthcare and how it evolved.
Yeah, well, initially, I guess it started in undergrad. I was in a pre-med program, anticipating going to medical school and doing something a little bit more traditional or conventional. And I had been a gymnast when I was in high school, and I was coaching girls gymnastics when I was in college. I had a bad weightlifting injury, went to a chiropractor. Chiropractor said, "Why don't you go to chiropractic school?" So that resonated, made more sense for me. It was a little bit more struck home with kind of more of my personality. So I went to chiropractic school, not really knowing a lot about it. I knew enough about chiropractic to know what was done, but I didn't realize the breadth of it, that there's actually subspecialties within chiropractic. It's not all just back treatment. So chiropractic school, I did very well. I graduated summa cum laude and didn't want to waste all of that knowledge. It's really, chiropractic school is like medical school. It's the same, many of the same types of courses. I took a lot of cardiophysiology, clinical cardiology, clinical neurology. It's a lot of education, and I didn't want to waste that. Also, concurrent with that training and that education, I did a Oriental Medicine program here in Chicago. So I graduated both programs as a doctor of chiropractic, and then I had the degree in Oriental Medicine, and I set out to integrate it all and to find my path. Basically, the path found me. So when I started out early practice, pretty much everyone I was seeing were women. This is back in the mid-'90s. And as a result, I was attempting to help them with female-specific issues that they were not being helped with. At that time, there really weren't any holistic gynecologists. Not really. So in 1995, I had a patient who was a colleague. She was a naprapathic doctor, and she had cervical dysplasia, which is a precancerous condition of the uterine cervix. When a woman gets a pap done at her annual, that's to screen for abnormal cells on the cervix, called dysplasia. And if it's abnormal, often surgery will be done to try to cut out the cells. But I instead knew of a treatment that involved the application of a solution that kills the abnormal cells, and it does it more artistically, more selectively than going in there with a scalpel. or with an electrocautery instrument, which is what's done. And I asked her if she wanted to do the treatment. We did the treatment. It worked. At the time, I was publishing a newsletter, so I wrote about this treatment for cervical dysplasia and HPV in my newsletter, and then another magazine picked up my article that I wrote. And then little by little, I had some patients that were seeing the articles and slowly started coming in. And over time, I became known throughout the country for this treatment. So at this point in time, I continue to treat cervical dysplasia and HPV. HPV is the human papilloma virus. The human papilloma virus is a wart virus, and this wart virus is associated with cervical cancer and rectal cancer, oral cancer, lung cancer. Actually, Kirk Douglas, I believe, came forward in the last couple of years and indicated that he had throat cancer, and probably it was HPV in origin. Go ahead.
No, I was just agreeing with you. Yeah, he did do that.
Yeah, so he contracted the human papilloma virus in the throat and in the mouth, and in some individuals, under certain circumstances, it can become cancerous. So this is the HPV big problem. We're starting to do some more work with trying to find a way to treat it better. But right now, at this point in time, the CDC says there's about 80 million Americans walking around with HPV infections. And the far majority don't know they have HPV. And in men, it can cause lung cancer, oral cancer, like I said. In some men, it could potentially cause rectal cancer if they contract it rectally. And then in women, if they have it vaginally, it's associated with this precancerous condition called dysplasia. And if in some of those women, the dysplasia will worsen and eventually become cervical cancer. So that's the concern. And that's the treatment that I specialize in for women is a natural way to treat the HPV as well as the cervical dysplasia.
Hey, let me ask you a question here. We know the H and the V, human and virus. Tell us or explain to us, what is papilloma?
Papilloma is, it refers to the word papillomatous, or which literally means kind of nipple-like. It's a little projection, and most, if you look at warts, whether they're on your feet, like a plantar wart, or on the fingers or anywhere, a wart kind of has a cauliflower-like surface. Mm-hmm. That cauliflower-like surface, or that broccoli-like kind of surface, if you look really closely, those are little tiny papillomas. So the reason we call it, that's the reason why we call it a papilloma virus, is because it causes all warts. There's about 150 different strains of HPV. Maybe about 50 infect humans in one way or another, and there's 15 of these HPVs that are called high risk. They're cancer causing. So right now there's about 15 that are more strongly associated with cancer. In women, you're looking rectal cancer, cervical cancer, vaginal cancer, oral cancer too, and men, same thing at rectal. Some cases of penile cancer, but penile cancer is uncommon, so we don't see too much of that. But then also, like I said, the lung and the throat cancer.
Mm-hmm. Now, you mentioned something about, I'm going to take the liberty of saying it's contagious. How does one contract it if it is contagious?
Yeah, it's highly contagious. Wart viruses, these HPVs, human papillomas, can live on the surface of an object for quite some time. I think most of us are aware of plantar warts, and especially when we were in high school and younger, they would make a big deal out of it going in the locker room or the showers, and to be careful being barefoot. And I remember my high school even had something you dip your feet in. It was some type of well, it wasn't bacteria, it was like an anti-wart type solution that you'd actually step into. But
really? Wow.
Highly contagious. most people contract it on their genitals through intercourse, through sexual activity. If you have oral sex, that's how you would normally contract it orally. And most of the time, if it's contracted rectally, it's usually through some sort of rectal sexual activity, whatever that may be. So it's highly contagious. It actually has been passed on to infants in utero, or fetuses in utero. So it's been found in semen. It's been found inside the sperm, actively replicating, so that when that sperm fertilizes an egg and the fetus develops, it's actually been found in amniotic fluid. So the fluid that surrounds a fetus as it's developing can have the HPV in it. And roughly somewhere between maybe 30 and 50% of infants, when they're born, you can find HPV on their genitals. Whether they're getting it from the amniotic fluid or whether they're getting it through vaginal delivery is debatable. But the point being, this stuff is all over the place. Most people have been exposed to it. The fortunate thing is that for maybe 95 to 98% of us, we're never going to have a problem with it. Our immune system can sometimes take care of it, but the concern is that in some people, some of the time, the immune system won't control the virus, and pre-cancer will develop, and in some of those cases, cancer will develop. So that's the big concern with HPV.
Yeah. You shocked me on some of this because I didn't know some of this stuff, but the question kind of comes into, because you're talking about how it's contracted sexually, and we understand, at least those of us understand, that let's just put it bluntly, the woman's vagina it can be an incubus for quite a lot, and we know that even men with some foreskin, that can lodge itself right up underneath the foreskin. But if you're not one who gets involved in sexual activity at this point, and stepping aside from just infants that are born, so teenagers and up, how does one actually contract this?
You're asking without sexual activity?
Yeah.
Well, it's less likely, but you can auto-infect. So in other words, say you were in a public locker room barefoot, a shower or something at the gym, you could have, the chances are when you walk on a gym floor, you're probably being exposed to HPV. That potentially then if you touch your feet, it could then be on your hands, and from your hands you could put it your face, your own genitals. This mode of transmission, we don't really know the likelihood of that happening. It probably does happen. Would I lose sleep over it and be all worried if I'm in the locker room or something? I don't think so. But nonetheless, it is possible to contract HPV without having sexual activity, and the way to do that would most likely be through like a floor of a public place, especially barefoot or something like that.
Okay, just before we go into this break, so basically what you're saying is you can get it from walking barefooted, then touching your own genitals or the genitals of another person if you're sexually active. And the best way to actually to fight this would be just to practice average hygiene. Keep your hands clean.
Yeah, correct. And, I don't know where I learned this, but at some point, must have been in a health class or something, maybe in high school, but the idea that you wash your head first and then make your way down,
Yeah.
And end with your feet, probably because your feet are going to be the most likely, you can get funguses on your feet and other things too. So you don't want to wash your feet first and then wash your face.
No, I don't do that either. with that, we're going to take our first break, so we're going to come back in just a couple of moments with Dr. Nick LeRoy, and he's going to continue telling us about his practice and some things that we can use on our own. So stay with us, and we'll be right back.
Hi, this is Richard Steinitz. I'm the author of Murder Over the Border, an Israeli detective novel, and Kaplan's Quest, a historical novel with an Israeli connection. I hope you like the books. You can follow me on Twitter, on Facebook, and even contact me by email on richard.steinitz@gmail.com. And I've enjoyed being here on K-Wave 6 Radio with Kirk.
Hi, this is Pat Kammer, author of Love's Voice Changes You, Book 1. And I now have Book 2, which is called Hello Awesome, Message from Spirit in Pat's Patters. Buy your book from Amazon.com.
Hi, this is Kate McKay, the Mass Motivator at kate-mckay.com. You're tuned in to the amazing K-Wave 6 Radio.
And welcome back to K-Wave 6 Radio. Today, again, my guest is Dr. Nick LeRoy. Before the break, we were talking about the HPV virus and how one could possibly contract it, and some of the things that you can do just to avoid contracting this virus, which is just basically keeping your hands clean and anything else that you touch in public areas. And as Nick was talking about, when you take a shower, start from the head and work your way down, not the reverse. So anyway, Nick, you wanted to continue with a thought on that?
Yeah, I mean, you know, like I said, most people, the estimates are maybe about 80% of the population either has HPV currently or has had it. So again, I don't want to alarm any of your listeners.
Yeah, no.
The concern isn't so much maybe getting it; it's making sure that you don't have a problem with it. And the way to avoid a problem with it, there's a lot of research on diet and nutrition, folic acid for women with cervical dysplasia. Folic acid has been shown to help get rid of it. Something called DIM, or diindolyl methane. It's a extract from broccoli. Even curcumin, which comes from turmeric. There's all sorts of plant chemicals that can help get rid of it. Your immune system plays into this a lot. So the healthier you are, the stronger your immune system, the less likely it is you're going to have a problem with it, and the more likely you're going to get the virus to go to clear, or at least to go to a point where there's such low numbers that you're not probably transmitting it and it's not going to be an issue. What I do for women with pre-cancer of the cervix, which is called dysplasia, is to use a solution of zinc chloride and bloodroot, which kills abnormal cells. So I apply this to the cervix repetitively, meaning once a week, twice a week. I apply the solution if it's women that are coming from far away. I have women who fly in from other states for this treatment. I'll maybe do 2 days in a row and do that once a month for maybe a total of about 8 to 10 treatments with the solution. And that'll slowly kill the abnormal cells until they're gone. And then the precancer's gone. Most of the time the virus will not be detectable. So that's the treatment that I do with women. I also address diet and some other nutritional factors that play into the virus as well. Back in '95 when I started this treatment for dysplasia and HPV, at the same time I was having some other. I mentioned that I was seeing a lot of women, so I was helping with female-specific types of issues. I mean, obviously breast issues are a big area for women as well. And I had a patient back then that had a lump. She was too young to do a mammogram, so I referred her out for thermography. And that was my beginning of using breast thermography for breast cancer screening. Breast thermography is using infrared to look at blood flow. The significance of blood flow is that when a cancer is developing in the breast, it needs more blood and more energy, and that's gotten via the blood. So the tumor cells actually secrete chemicals that increase blood flow, as well as the growth of blood vessels toward the developing tumor. And we can see this with the thermography. There's no radiation, there's no compression. So I started using that in 1995, and for a long time I was really the only doctor in Chicago that was doing breast thermography. There's a few more places now, but they don't have the amount of experience, I don't think, that I do after doing it for 20 years. But it's a good alternative.
Right. Before we go any further, Nick, let me ask you this. Do a little comparison, because I would assume that there are probably some women out there that have never really had a breast scan, and they don't know what it's all about. I know that, of course, being male, only I know is about what I've actually read and seen about from my own studies, but it's basically mashing the breast up against some plate. And why don't you tell us about the difference between the two?
Yeah, a mammogram uses X-ray or ionizing radiation to penetrate through the tissue, where depending on the density of the tissue, the X-ray themselves will cause a change in film, the X-ray film. So the reason why we smash, or I shouldn't say we, I don't do that, but the reason why when a woman gets a mammogram, they want to get the breast as flat as possible. If they could get it as flat as a pancake, that would be ideal, because the less tissue the X-ray goes through, the more accurate it actually ends up being. Now, obviously, that's not very comfortable, and some would be concerned with the fact that if there's a tumor there, but that maybe compressing it so much might cause the tumor to rupture and spread. But the mammogram is dependent on the ability to flatten the breast between two plates. On the plate is X-ray film. You put radiation through, and then you have an X-ray. So basically, a mammogram is an X-ray of the breast. The problem is that it's density dependent. It only shows density in the breast, and that can be confusing. There can be calcium deposits or calcifications that are not cancerous, and when those show up, right away they want to do a biopsy, and 80% of the time we do biopsies here in the United States in the breast, they're normal, they're benign. It's not cancer. So we're terrible at determining who needs a biopsy of the breast, because the mammogram isn't very good at distinguishing when it's cancer or when it's not cancer. Mm-hmm. Now, in contrast to that, a thermogram does not use radiation. There's no compression of the tissue, because we're not looking at density. With a thermogram, we're looking at blood flow, and what we see is actually basically a picture of the breast that has all the blood vessels evident. So you can actually see blood vessels, and what you see is termed a thermovascular pattern, and there's certain findings that are associated with cancer or pre-cancer. And we can start screening at a younger age with a thermogram, because there's no radiation. So you can start screening as early as 20 in women who are at a higher risk of cancer, like a family history. Whereas a mammogram, the best guidelines to date, which were the U.S. Preventive Services Task Force guidelines, those were commissioned by Health and Human Services. They were released in 2009. Those guidelines say for women to start at 50 with a mammogram and do every other year after 50. Now, those guidelines were mostly ignored, but the point is that what that underscored is the fact that there is a risk to mammography because of the radiation. Radiation does cause cancer, so we know that mammograms do contribute to causing breast cancer, so there's a potential risk involved with a mammogram. And there's some more recent studies. Just in February of this year, the British Medical Journal published a study. It was a 25-year Canadian study, and it looked at whether mammograms actually saved lives. And what was found is that mammograms do not save lives. They found that there was no difference whether you get a mammogram or don't get a mammogram as far as whether you live longer. And not only that, that same study also showed that there was overdiagnosis because of a mammogram. So what mammograms are really good at is finding non-aggressive cancers that somewhere between 20 and 30% of the time do not need to be treated. The problem is that when you find one of these non-aggressive cancers, we don't know whether it's aggressive or not, and women end up being treated. So there's a liability when you do screening mammograms. There's a liability that you're going to find a non-aggressive cancer that ends up being treated and it didn't need to be treated. That's not the case with thermography. We tend to find aggressive cancers very well that are often missed on mammography.
So tell me, now, let's just go into surgery, because I know this to be basically a fact. I haven't had to deal too much with surgeons in my lifetime, and definitely never on a personal basis. But to have an operation to open the body, to even just to do a biopsy, what are the risks for other problems later in life from that?
Well, we don't know. I mean, there's a concern by some that with certain types of biopsies, it may spread the cancer, if there is cancer there. In conventional medicine, the assumption is made that if there's a cancer there, you're going to treat it, and you're going to treat it aggressively. Not all women want to treat it aggressively, and some of the time there's reason to not treat it aggressively. So as far as down the road problems with, doing some types of biopsies, where surgery is mainly whether you're going to facilitate the spread of cancer. In energetic medicine, which we haven't talked much about now, but in Chinese medicine, for example, there is the idea that there's energy that flows around the body, and there's things called meridians. Mm-hmm. There are some that would be concerned that by doing incisions and surgery and removing things that you may be disrupting the flow of energy in the body. So that may be a potential concern. There's definitely a time and a place, I think, to do some types of surgery. It's just a matter of figuring that out.
Mm-hmm. Let me ask you this, because you just made me think of another question, but I'll bring that up later. We've spoken about mammographies and how to actually essentially get this x-ray. How does thermography work? I mean, I've seen some of the pictures when you and I were working together back in Chicago, but for our listeners, how does that actually work? Well,
a thermogram uses infrared technology, and infrared is it's a different wavelength of light. Basically, we can't see it as humans. But all objects above absolute zero emit infrared radiation directly proportionate to the heat. So the higher the temperature of an object, the more infrared it emits. So there's a direct correlation with temperature. The significance of the breast is where there's more blood flow in the breast, there's a higher temperature and more infrared emission. So when we do a thermogram and we see the actual picture of the breast and the blood vessels that are in the breast, we're actually seeing basically a thermal representation of blood flow. So we're seeing blood flow, but it's as indicated by the degree of heat. Now, back in the 80s, studies were done that confirmed that using thermoelectric probes, they would probe into the breast where there was, it appeared though there were blood vessels in higher temperatures, and they did find that there was in fact higher blood flow. So where there's higher temperatures, there's higher blood flow. So again, we're measuring the emission of infrared radiation from the body, and that's directly correlated with the amount of temperature, and the temperature is directly correlated with the amount of blood flow.
Mm-hmm. So if a woman were coming to you for a thermogram, what would she expect, especially in comparison to what we already know about mammograms?
It wouldn't hurt.
Huh?
I can say that, yeah, because there's no compression. My office visit, we sit down, we go through history and everything, and as I said, there's no compression. So we need to, you have to be on bare skin. So normally a woman has to be disrobed from the waist up. For a little bit, there's an acclimation period. You want skin to kind of cool off and equilibrate with the ambient temperature in the room. So normally I'd leave the room for about 10 minutes or so, come back in, do the imaging. I capture the images digitally, and then I talk with the patient about it. So we look at it, and I can give her an idea right then and there whether there looks to be a problem, whether there's any abnormal blood vessels or anything that's unusual. I always do a palpatory exam, so I also do a physical examination, because if I see a lump or feel a lump or a thickening or a lymph node that correlates with something that I'm seeing on the imaging, that may change my impression, and I may have a different recommendation. So that's pretty much what I do on a visit, and then I do a report, and I send the report along with the images to the patient. And then if everything looks good, we do a follow-up, and now we have a baseline. So every time we do a follow-up, I compare back to the baseline, and it shouldn't change. It's kind of like a fingerprint. So what we're seeing is basically a vascular or a blood vessel fingerprint of the breast that should never change.
So basically what you're saying is that you don't have to send them to a radiologist to have an appointment at a hospital. And what are you using to capture the image? Just a regular camera, or what?
Well, it's an infrared camera. They're kind of expensive. So those types of cameras can range anywhere from $20,000 to $50,000. They display real time, so I have it has a video output basically that, and then it has to go through a video capture device into the computer, and then I have special software that's designed specifically for doing breast imaging, so I can capture the image in effect digitally, and then I can manipulate the image, and then I can also do quantitative analysis. So the software is such that I can pinpoint specific blood vessels and then make quantitative analysis. So I can look at one area of the breast and make comparisons to another area of the breast and see whether there's significant differences. There were guidelines that were developed in the 80s to interpret breast thermograms. So I follow those guidelines, and there's certain temperature differences from one area to the other that are considered significant or not significant. So I go through a whole interpretation like that.
Gotcha. We're going to take a quick break. We're in the middle of the hour, so if you'll stay with us, we'll be right back with Dr. Nick LeRoy, and we'll furnish up our discussion on thermography, and we're going to let him roll with some other ideas that he has to share with you. So stay tuned, and we'll be right back.
Hi, this is Megan Serleski, author of Who Am I? How My Daughter Taught Me to Let Go and Live Again, and I am on K-Wave 6 Radio.
Hi, this is Amy Young of JSJ Phone. We are providers of junior iPhone, iPad, iPod, also Samsung, Sony, Nokia parts and accessories at very good quality and low prices. We sell to individuals, and companies have 3 to 5 days delivery time by DHL or UPS. We do delivery in 24 hours after payment confirmed. For more information, see our website www.jsjphone.com www.jsjphone.com. Contact me, Amy Young, mailbox emy@jsjphone.com, or by phone 0086 134 1869639 by Skype emy.yang2012.
Do you get writer's block or tongue-tied when you try to write or talk? Need a wordsmith for a script, article, or research paper? Let K-Wave 6 Productions help you with all of your audio, visual, editing, and language translation needs for your business or hobby. Does the thought of creating a website give you chills? We also have webmasters to help you with all your website needs. Remember K-Wave 6 Productions. www.kwave6productions.tk or email us at info.kwave6productions.tk.
Hey everybody, this is Jason Pockrant of Live to Give over at jasonpockrant.com, and you are listening to K-Wave 6 Radio.
Hello and welcome back to K-Wave 6 Radio. Today my guest is Dr. Nick LeRoy. And before our break, we were talking about thermography and how a thermogram is taken. He was talking about, Dr. Nick was talking about how it is just taken with a camera. There is no need to make an appointment to go see a radiologist. You don't have to go to a hospital. You don't have to compress, or if, in my unscientific way of saying it, you don't have to smash your breast up against a plate and go through all that. It can be done right in the doctor's office, his doctor's office, and the results, if I am correct, this is where when I asked the question, you said this is all done in real time, so you can actually show the patient right after you've taken your thermogram and discuss what you've seen. Is that correct?
That's correct. That's exactly what I do.
Cool. So tell us a little bit more about that then. How do you explain this to a person? Because I've seen some pictures of this, and in my own way of putting it, the colors are like looking at a psychedelic rainbow. So,
yeah, I just, I explain what I look for and looking for symmetry in the vascular pattern. So I give a quick explanation of kind of what's considered normal, and there's a qualitative analysis where I look at how it looks, the symmetry of the types of blood vessels, and then quantitatively I look at our actual measurements, so I can use the program to actually analyze different areas and get a numerical analysis or a quantitative analysis. So there's, I explain all of that, and then when we're done and I do my physical examination, if everything looks good, I say everything's good, and I explain my report. Will say the same thing, and we'll do our follow-up, and that's that. So, yeah, pretty straightforward.
Mm-hmm. And it's very comfortable for the woman to do, because as women have described to me, I think even my mother told me, it's just you're putting yourself up against this cold plate, and you're just having to mash yourself into this, and it's just terribly uncomfortable. So yours is, in comparison, it's just, just speaking bluntly, is just remove your clothes from the waist up, sit in a room by yourself for about 10 minutes to let your body adjust to the ambient temperature of the room, so there won't be any false readings.
Correct.
And it's all done that way.
Yep, it's a walk in the park. No squashing.
Yeah, and there's no need to really return to see you to see the results of the exam or the thermogram.
No, yeah, there's no need. I email the results, the report, because I do a report, also a written report, and the images, and I can also send those to any other physicians that the patient might want me to send them to. But yeah, then we don't need to get together until the next follow-up.
Yeah. Now, you touched on this before, and I want to hear it from your own words. What do you, because you have another degree in Oriental Medicine, so describe what is holistic.
Well, I mean, it's kind of changed in the last 20 years, I think, a little bit what holistic is, but a general way of defining holistic medicine is more looking at the whole person. We've been accustomed to medical specialties in this country. We have, in conventional medicine, you have a kidney specialist, a liver specialist, a pulmonologist or lung specialist. So you have all these different specialties, in part just because the amount of things that are that a doctor needs to know are so vast that it's hard to know everything. It's kind of impossible. So we've kind of been accustomed to this sort of reductionistic thinking. So what pervades allopathic or conventional medicine is this reductionistic thinking. If you have a problem with your gastrointestinal system, you see a gastroenterologist or a GI doc, and they're not going to usually look at too much of anything else. They just look at your gut. A holistic doctor, by contrast, or holistic medicine is not reductionistic. It's attempting to kind of look at everything as it fits together, and in this person's life, that often includes spirituality, maybe even energetic medicine, things like that, but not necessarily. For example, I don't tend to deal a lot with energetics. I tend to be more in the physical realm and biochemical realm. So I'm a holistic physician, but I kind of work more in the realm of biochemistry. So I'll do all different blood work. I'll look at the whole person. I do acupuncture. I do chiropractic. I do heavy on diet and nutrition. And the attempt is, most of the time by holistic doctors, is to use natural medicine as opposed to drugs and surgeries. So you're really trying to treat things by addressing lifestyle behaviors, including diet and supplementation and nutrition and things like that. So that's really the main difference.
Let me ask you this, because I've given an example of my own therapies down here. Have you run across anyone that has caused themselves, just say a physical imbalance just by the way they think?
Oh, absolutely. Goodness, what we think is just so powerful, and there's literally how we think affects, it's been shown in physics to affect our reality. I mean, that gets a little little abstract, but the fact means that it's as though even our own observation can actually modify reality, as strange as that may seem. But in the human body, at least, there's a direct connection in the brain from the cortex and what's called the thalamic nuclei, which kind of sit below the cortex, and the hypothalamus and pituitary glands. So when we talk about the endocrine system or the hormonal system, which are your adrenal glands, the ovaries, the testes, the thyroid gland, you have all these different hormonal producing glands in the body. That's the endocrine system, and the master gland of that whole system is the pituitary gland. So the pituitary gland controls all the hormones in the entire body. But what's noteworthy is that pituitary gland sits beneath the hypothalamus, so it's controlled by the hypothalamus, but the hypothalamus sits below the thalamic nuclei. And what we've learned is that the thalamic nuclei process information coming into the brain. Some of it you're aware of, some of it you're not aware of. But the thalamic nuclei can sort of be programmed to modify information, and it'll affect some of the other functions, including the function of the master gland or the pituitary gland. So literally, how you think and your mood has been shown to have an impact even on your hormonal system. So there's actually a very intimate connection between parts of our brain that have more to do with just thinking and mood, and then the areas of the brain that actually control physiology, and part of that's being controlled through the hormonal system. So there's really a direct connection. They're kind of, in effect, they're kind of one and the same.
Mm-hmm. So how do you work with people that are basically causing their own problems through thought?
Oh, goodness. That can be challenging because, after 20 years, I can sit down and pretty quickly see when a person's kind of doing that. Often some of it's sort of patterns of thinking, maybe neurotic thinking, and by neurotic I mean just kind of unrealistic thinking. In other words, up in their head. Many people who are suffering chronically and are creating some of the illness themselves tend to be in their head too much. They're never, present. They're always projecting into the future or into the past, and that's not healthy. So very quickly I can sit down with somebody and get an idea whether that's an issue or not. It's a little bit frustrating because they generally do that because they don't understand it and they're not aware of it. Sometimes they even take pride in that fact and in effect take pride in damaging their own body. It becomes part of their egoic thinking or part of their identity. When I hear something like, I don't go to sleep until 1 o'clock because I'm a night owl, I'm thinking in my head, okay, well, no, you're a human, not an owl, and you're a primate. And like other primates, all primates go to bed when the sun goes down, and they get up when the sun comes up. So there's this evolutionary programming that we've developed, and all primates have, including us. That's what we're supposed to do. So in effect, basically when somebody says I'm a night owl, they're telling me that I'm screwing myself up and I take pride in it. The pride is that they identify with it. It's part of their egoic identification is to say, I'm a night owl. And you start seeing, and this goes back to the neurotic thinking, people who think neurotically use absolute terminology. They'll say something like, I can't meditate. I tried and I just can't do it. Ironically, a person who says they can't meditate because they're just thinking too much and they can't settle down, that's the very person who should be meditating more than the rest of us.
Yeah, indeed.
So there's definitely many of us are challenged with being up in our heads and thinking too much and identifying with that voice in our head, which is not always a good thing to do. So
you remind me of some of this New Age stuff where people are identifying with animal totems and I am this and I am that. You're just, as you said, I'm a primate. There's the reason why I was asking, and I'll share something, and other people who've maybe listened to the show, they've probably heard this, so I'll give the very short, the Cliff Notes version of this. A few years ago, I had a client down here who came in to see me. He said he had seen 4 doctors, including a specialist. Nobody could help him out. This guy's average height and this is not, the heck with it. This guy's an average height for a Mexican guy. Okay, he's around 5'7", give or take. And he came in with his mother. He's 40 years old. His mother is in his 60s. And he was normal-looking guy for a guy, slim and wiry, put it that way. Except he looked like he was 9 months pregnant or swallowed a basketball, take your choice. Couldn't figure out what the heck the problem was. And I've seen some other people like this, but they had abdominal cancer. So I was going, what's the problem that other doctors couldn't figure this out? He said, no, his problem was he couldn't urinate. And he could move his bowels twice a day sometimes, but he couldn't urinate. Puzzled me to death. So I put him on the massage table and I did some auricular therapy, but every place that I hit that was related to stress, this guy would almost yell out. Actually, he did yell out. He didn't scream, but he did. Yeah, anyway. So I wrote down some notes. I took him in after the therapy, and I talked to him, and I asked him about stress. He acknowledged that he had stress, and he gave all the reasons. I taught him how to release the stress, how to let go of live in the now. He called me 2 days later and says, he's in the bathroom, and he's urinating, and he can't stop. That's what I was just talking about. That's the part of holistic, at least from my point of view, is doctors, traditional doctors, put it that way, those who are not practicing holistic therapies, and actually down here, they're cool about that. But the traditional doctors are the ones who, they look for the symptoms and they want to attack the systems. Here, take this drug for this, or here, take this for that. And holistic, at least from my point of view, is understanding, as you said it, is understanding not only the body, the physiology, but also the mind.
No, that was a good example. You hit right on, I like to say with what causes, for most of us, what's going to make or break you over time is diet and stress, really. And it's probably weighted more towards stress. But a lot of the stress that we experience is sort of, it's self-originated. We tend to stress out, per se, over things, and much of the time it's because we're not, as you said, we're not in the now, we're not in the present. We're always trying to escape the now or the present, and in doing that we create more stress. So it's definitely a challenge, but it's noteworthy that for most of us it's probably the main thing that creates illness or disease over time is actually stress.
Yeah. With that, we're going to take our last break, so stay tuned and we'll continue this interview with Dr. Nick LeRoy, and let him tell what he's going to talk about when he comes back. Stay tuned. We'll be right back.
Hi, I'm Doug Harold. You're listening to the K-Wave 6 Radio with my friend Kurt Spencer. I'm with Time and Eternity, timeandeternity.net. I'm really glad you're listening to the K-Wave 6 Radio.
Are you ready to put an end to thinking about how you wish it were and take action? Take this step to find out more by going to coachingbyria.com. And you can receive your free consultation session with Coach Ria. Coach Ria is a certified professional life coach with a passion to help make the difference in the world.
Aloha from Maui, Hawaii. This is Carrie Gray of My Green Insurance at mygreeniinsurance.com. Thank you for joining us. We're the first co-op for alternative medicine health coverage. You're listening to us on kwave6radio.tk. Aloha!
Hello and welcome back again to K-Wave 6 Radio. In our final segment now, my guest has been and continues to be Dr. Nick LeRoy. We were just talking about, before the break, about holistic medicine, holistic therapies, and understanding that not every problem can be solved with a pill, with a potion, with operation, whatever the case may be. Holistic just means the whole person, from a spiritual level down to thoughts to physical. So, while we were on break, I was talking with Dr. Nick here, and he was talking about, he would like to talk to you about diet and taking responsibility for yourself. So, Nick?
Yeah, thanks, Kurt. I guess one of the things I often hear, and I do a lot of work with gastrointestinal disorders, everything from gastritis, reflux, IBS, Crohn's disease, ulcerative colitis, a lot of different things like that. I often hear how people are confused. I probably hear this more with weight loss, but the claim is that they're confused, they don't know what to do, and it's somewhat understandable. I mean, if you were to just listen to what's happening in the media, there's a lot of controversy, and it's just because controversy sells. You'll hear about a study where chocolate's good for you, then chocolate's bad for you. That's all just nonsense. There's just a lot of controversy is interesting, so that's intentional, just to try to draw viewers. But at the end of the day, when you look at prevailing trends, I think that you could ask any 10-year-old, and most of them know what a healthy diet is. Mm-hmm. We all know. All know it's healthy. I don't think there's any confusion about that. I think most people, the average person, knows that they're supposed to be eating, more vegetables, more plants, more fruits, more fiber. I don't think there's any confusion. To me, I look at it more as an excuse, and this is more with weight loss than other gastrointestinal disorders. But at least with regard to weight loss, individuals that struggle with weight, they tend to have issues with food, that some of us don't have. So I mean, I'm not necessarily pointing the finger, but at the end of the day, we each are responsible for ourselves. You know, we each have to take care of ourselves.
But you mean the doctor isn't responsible for us?
Yeah, God forbid.
Yeah, because we always like to point fingers at somebody else's responsibility. So you're the doctor, you're the one who's responsible for my health.
Or they think they're damaged, like something's wrong.
Yeah.
That's one of the most common things I hear with regard to weight loss is, there must be something wrong with me. I can't lose weight. The claim is they eat like a bird and work out and do all these things and can't lose weight. And what I usually say to that, sometimes there is a metabolic problem like thyroid disease, but that's like not common. I'll do blood work and just make sure there's nothing wrong, but it's almost never that there's a metabolic problem that can be identified. My comparison usually is to people that say that they're eating like a bird and they can't lose weight is, it's maybe in bad taste, but it kind of underscores my point, which is, did you ever see an overweight person in those pictures and films from people who are in concentration camps? You know, when you look at people who are under severe food restriction, they're emaciated. They die from starvation. So you can't tell me that you're not eating anything and you're somehow defying the very laws of nature and creating calories out of nothing, out of thin air. It just doesn't happen. Mm-hmm. You know, some of us have a harder time, of course, and people who are naturally thin tend to be able to eat and not have to worry about it as much. So it's unfortunate that some of us have to think about it more. But at the end of the day, it's our responsibility. If you're overweight, you need to find a way to lose weight, and you need to take the responsibility. And to use a cop-out and say, well, it's confusing, or I don't know what to do, it really isn't confusing. It's pretty straightforward. And there's always a mathematical equation to weight. It's calories in and calories out, for the most part, with some minor manipulations of that data. But at the end of the day, it's calories in, calories out, and have to be able to take the accountability to lose weight. And this is becoming more of an issue here in the United States because we're moving towards socialized medicine. We're moving towards the expectation that you shouldn't be disqualified for insurance with pre-existing conditions and things like that. But I'm sorry, but when I'm sitting in a restaurant or out somewhere eating and I see somebody that's 200 pounds overweight going back for their, third or fourth soda or sweet tea or lemonade, I get a little bit angry. I take care of myself. My weight's where it should be. I eat well, and I don't expect to have to pay for somebody else to not take care of themselves. Yeah. So there's definitely an issue with that, and it's about accountability and doing what you need to do.
You might have a friend of mine, which maybe I'll introduce you to one day. She's been on my show twice. Her name is Belinda Farrell, and she is she learned the ancient art of Hawaiian healing. And one of the things that she said in the last interview I had with her a few months ago was that part of the healing process in ancient Hawaiian healing is taking responsibility for yourself.
Boy, that's extremely intelligent.
Oh yeah. Yeah, you can't go passing it off. I mean, put it this way, even using, like in the previous break, or the break just before we got into this segment, was that the man that came in here, and he understood that his was stress-related. He just didn't know how to get past it. And once he did what I told him how to do, 2 days later, problem solved. He took responsibility for it. He didn't pass it on to anybody else. The stress was his. Not, oh, I don't know if you're old enough to remember the Flip Wilson show. The devil made me do it. Okay, just passing the buck off to somebody else. Take responsibility for your own actions. Your own health will get better. Nick, we have about 7 minutes here, give or take. Do you have anything that you would like to impart upon us, to teach us, or whatever?
Well, boy, we covered a lot of ground. We covered everything from thalamic nuclei processing of food and thought to good grief. Well, I guess my gosh, we even covered accountability and, with health and everything. I think one thing maybe that we didn't cover or that we could just talk about is with GI disorders. When you eat a food, your immune system's not supposed to react to it. One of the things that I do often for gastrointestinal problems, and I've done this almost for 20 years because I get such good results with it, and so do other holistic docs, but food allergy testing can just be amazing. I'll give you a short case study. I had a patient, this was a couple of years ago, he came in with something called rhabdomyolysis. Rhabdomyolysis is an acute breakdown of muscle tissue that can cause kidney failure. You can die from it. It's life-threatening. Often it's caused by medications, the most noteworthy being statin drugs for cholesterol. So Lipitor, Crestor, Zocor, these types of cholesterol drugs. One of the side effects is rhabdomyolysis, and that's why in commercials for those drugs they'll talk about muscle pain and about liver enzymes and to get that stuff checked and stuff like that. So this patient came in, he had rhabdomyolysis, his liver enzymes were elevated, including a muscle enzyme that indicates the muscle breakdown, and he was very sick, very fatigued, a lot of muscle pain, and it was potentially life-threatening. He wasn't on any statin drug for cholesterol, but he was on a medication for GERD. He had gastroesophageal reflux, so he had heartburn and reflux, and he had been on a medication for 2 years. Now, these medications for antacids, basically, there's no research that goes out that far. They were designed for ulcers, and you'd stay on it for maybe 8 weeks till the ulcer heals in the stomach or the small intestine, and you stop the medication. But now what's happening is we're getting so many people, because of stress and diet and lifestyle, that they're getting reflux into the esophagus, like heartburn, and doctors will put these patients on medications for years, and they drop the acid, the stomach acid, and then you get digestive problems because you're supposed to have stomach acid there. That's what digests your food. Mm-hmm. But in any event, he was on his medication for a couple of years, had the rhabdomyolysis, and what I like to do is when I see a patient, if they're on prescription medications, I'll actually pull up the medication online and I'll look at all the side effects, because there can be hundreds of side effects. Well, what was interesting in his case is that the side effect of the medication he was on was rhabdomyolysis. So in rare cases, it can actually cause muscle breakdown and elevated liver enzymes. So here it is right on the manufacturer's description of the drug, the fact that this can cause the very symptoms he was getting. Now, do you think that anyone else found this?
No.
It's like, no. So he went back to his doctor prior to seeing me and said, well, could it be from this medication? The doctor flat out said no, without even knowing all the full side effects of the medication. It turns out he was wrong, and that the manufacturer of the drug admits that in some cases it can cause this condition. Well, in any event, I had to get medication, but to do that, I needed to get rid of the reflux. So I like the food allergy testing for that. It's objective. It's a blood test. I can test for antibodies to a whole boatload of spices and different things. So I did the testing, found out what he was sensitive to, and just changed his diet, got rid of all those foods, of which, there's maybe about 30 foods. And within a week, he was off the medication. Within about 3 weeks, he was feeling great. Within a month, his enzymes, his liver enzymes, and the muscle enzyme was becoming more normal. And within 3 months, he was 100%. Liver enzymes were normal. The rhabdomyolysis was gone. Feeling like $1 million. Problem solved. I sometimes do some teaching for different places, and I'll do case studies, and I'll present a case sort of like what I just presented. And my comment to soon-to-be doctors is don't ever underestimate the side effects of medications. Yeah. It's really extraordinary how people will take a medication, and anybody that watches TV sees the commercials. At some point in the commercial, they say possible side effects are explosive diarrhea, death, all these different side effects. And yet, when they're on a medication and they're having a problem with it, I don't think I can ever recall a patient who actually looked up the comprehensive list of side effects. Instead, they'll look everywhere else for why they're sick. They'll look at, maybe it's because I started eating healthier.
I've heard that one before.
Yeah. It's like, yeah, okay, no. Here they're on this powerful drug, and instead of thinking it might be the drug, they think that it might be because they're eating more kale.
Yeah. Mm-hmm. Maybe I should just go back to eating just garbage food again. Everything will be fine, right?
Yeah.
Well, Nick, thank you for this interview. Let me ask you this. Would you give us your website and how people can contact you?
Yeah, my website is drnick.net. It's drnick.net. I'm here in Chicago. I have pretty much everything we talked about is on my website. I'm pretty much at my office every day.
Okay, and as a personal reference, I've worked with this man and still good friends with him. I highly suggest him if that's permissible, even on my own show. And you said that you've had people coming to you from other states. If you had people coming to you from other countries?
Here and there, sometimes I'll do Skype consults with people from other countries if I can, if it's amenable. I've even helped other physicians in other countries do my cervical dysplasia treatment, and then they'll do images of the cervix during the course of treatment. They can send to me, and I can review it, and then I can kind of guide them as far as how much they need to treat and what they need to do.
Cool. Oh, that's wonderful. And once again, the website is drnick.net, correct?
That's correct.
Beautiful.
Correct, Kurt.
Well, hold on just a moment, if you will. Just say a final goodbye, but I just have to give these final messages here. For all of our listeners, you can hear all of our episodes on iTunes, Stitcher, podcast.com, RSS feed, and on YouTube. We do our shows every Tuesday and every Thursday. They're posted online and podcast by 1 o'clock Eastern Time. And all of our shows all of our players are computer and smartphone friendly, so you can listen to them while you're on the go. All of our episodes are free. We don't charge you to listen. You can subscribe to each player for updates, automatic updates, so when the shows come on, you can just click on it and listen. Also, you can subscribe or follow us on our website and our blog. And we ask that you support the advertisement. You can always go to our website and click on the page that says Advertisers. Takes you straight to their webpage. If you have any suggestions and or comments for the show or some ideas for a future show, give us a call. Not a call, but send us an email at info@kwave6radio.tk. That's info@kwave6 radio.tk. And with that, once again, Nick, thank you for being here. We hope to have you back again soon when you have some more information you'd like to share with us.
Thanks, Kurt. I had a great time.
Great. And thank you for the listeners for being here, and we'll see you again soon. Take care and always be well.
Thank you for being part of our audience. For more information about K-Wave 6 Radio and the services we offer, go to www.kwave6radio.tk. Have a wonderful day.